Assalamu alaikum everyone. Hello and welcome to Happy Eyes Pod, your number one African eye care podcast where we explore the world of eye care one blink at a time. I'm your host Dr. Amal, optometrist by profession, educator by passion, and your guide on this journey to clearer vision and smarter eye care. Welcome to another episode of Happy Eyes, your number one African eye care podcast. I'm your host, Dr. Amal, and I'm thrilled to have you with us today. Today, I have the pleasure of welcoming a very special guest, Dr. Kabiru Labaran Ubale, the current president of Bayero University Optometry Alumni Association Nigeria and pioneer head of Dispensing Opticianry, Federal Polytechnic, Kabo. Dr. Labaran is a dedicated leader and a true force in our community. He's been tirelessly advocating for excellence in optometric education and practice, and under his leadership, the alumni network has not only strengthened professional bonds, but it has also launched impactful initiatives that are shaping the future of optometry, especially in northern Nigeria. To start us off, Dr. Labaran, welcome to the show.
Thank you, Dr. Amal.
Okay. To start us off, can you share a bit about your journey into optometry and what inspired you to take on the role of the alumni president?
Okay, good morning, everyone. I'm delighted to be here with you to share some important things about the eye care in general. So, actually, I didn't initially apply for this profession, but I have come to realize that it suits me very well. You know, sometimes life presents unexpected opportunities
So true.
that turn out to be the right fit. So
Yeah.
actually, I discovered that this profession is the right thing for me because I have the opportunity to help people see the beauty about this world. You know, the most important things that we do is prevention of blindness and some other diseases, especially in this developing country, Nigeria. We have a lot of things affecting people's eyes. So actually, I'm very happy and I'm satisfied with what I'm doing in this profession. And
That's
also,
actually good to hear. So
being the president of
optometry turned out to
alumni,
be
yeah,
a blessing in disguise. Is that what you're saying?
exactly, yes. And also, being the president of alumni association was, I have a deep commitment to improving this profession, especially in my alma mater, which is Bayero University, Kano, as well as also to improve the eye care in our community. And so this leadership gave me the opportunity to like drive this vision forward. So Alhamdulillah, we thank God.
Okay. Thank you for that inspiring introduction, Dr. Labaran. Now let's dive into today's topic. Today's topic is one that's urgent but often overlooked: ocular emergencies. So let's start with the basics. When we talk about an ocular emergency, what exactly are we referring to? I want you to explain it in simple terms, not professional terms, so that all our listeners will come along with us.
So if we say ocular emergency, the ocular is a medical term. So let me simplify that
Kid
one
down,
first.
yes.
Anything ocular means so I can say like eye emergencies. So when we say eye emergencies is anything that needs serious attention is referred to as eye emergency. And if care has not been taken, this thing can lead to maybe loss of vision or some permanent disabilities. So
Okay.
that's the
Basic.
eye emergencies or ocular emergencies if we are using the medical terminology.
Okay. So, what are some warning signs or red flags that people often ignore? Signs that actually require immediate attention, but people often overlook.
Okay, so when we talk about the signs that people often overlooked, especially with regard to eye emergencies, different signs and symptoms depends on the type of eye problem that you had. But some of the commonest things is like double vision, eye pain, some severe form of headache. It should be people taking paracetamol, but the headache didn't go away.
Go,
So
yeah.
sometimes they were related to the eye and they can lead to serious problems. Feeling something inside the eye is something that you shouldn't overlook. Redness or bloodshot in the eye, you know, being sensitive to light, you are afraid of looking at the light. When you do that, you feel pain inside the eye. Some bleeding bodies in and around the eye. So these are some of the signs or symptoms that people
Often
shouldn't
overlook.
overlook.
Okay. So does
Yes.
every minute count? Meaning, is it
Yes,
really
exactly. Well,
important for them to rush to the emergency room when they see any of these signs or red flag? Or can they take their time?
definitely. Yes, definitely they need to go to the hospital. As I define the eye emergencies are things that need immediate attention. So when we say immediate attention, it means every second counts.
Okay.
Missing, waiting for some few seconds, it may lead to so many things, so many problems. So
Permanent
every
damages.
second counts.
Okay.
What is wrong?
So let's settle this. Do red eyes always mean it's an emergency?
Well, I can say yes, and I can say no. Some some
So
red eye
clarify.
actually, yes, we have different causes of red eye. So many eye conditions can cause red eye. Some of those conditions can lead to serious damage, while some are just some mild things that will even go away on them on their own. But
Okay.
normally, there are a lot of diseases, uveitis, glaucoma, some certain eye
Conjunctivitis,
infections, yes, conjunctivitis,
foreign body in the eye.
trauma,
They all
blow into
present
the
with
eye.
red eye.
Yes, they do present with red eyes. So
Okay.
these are the things that you should not overlook. You need to come to the eye clinic immediately. But
So
maybe red eye,
basically,
what
red
you
eye
wake up in the
isn't
morning.
always an emergency, but it's good to go and get it checked.
Yes, it's not always an emergency, but it's only your doctor that will
Can tell
determine
you
this
whether
red
it
eye is
is
an
or not.
emergency or not.
I like
So
that,
the best
yes.
thing to do is to go to the eye care professional.
Okay. So, what should people do immediately if they or someone they know is having an eye emergency? If someone experiences an eye emergency, what's the first thing they should do? Let's go through a few scenarios to make it very clear. If dust or
Okay.
insect flies into the eye, what should a person or a good Samaritan that is helping out do?
So if a dust or an insect or any foreign material that enters the eye, what you should do is try to look out for that foreign object or that insect. If you can see it, remove it maybe with cotton bud or use water to clean the eye. So generally, cleaning the eye with water is the first thing you should do when you encounter things like that. If
Okay.
the thing could not be removed with water, maybe ask your friend to look at the eye if he is able to identify that objects. I mean, small objects, there are some bigger and deep objects that penetrate into the eye. I'm not talking about that ones.
Those ones,
Those
yes. We're
ones
talking
you have
about
to,
dust or an insect that you
yes,
can see on the surface of the eyes, right?
yes. So try to clean them out, flush them out with water, clean water, or ask your colleague to look for it. If he is able to see them, then use maybe cotton bud and uh, try to remove those particles.
Okay. So let
This
me
is
add
what.
a few things to what you just said. It's very important to ensure hands are clean when you're dealing with the eyes. If not, you might be introducing some form of microorganisms, some bacteria into the eye in the process of taking out
Yes,
the
this is
insect or the
correct.
dust.
This is correct.
Yes. And then when you talked about cleaning the eye with water, people usually have a phobia of water entering their eye. So they might think we were actually telling them to clean the eyelids or the surroundings of the eye. No, we're saying flush the eyes with water, clean water.
The,
Pour,
the clean water.
yes,
These are
should be
used
poured
the
into
well
the eyes.
water. Mm,
So I think that's it. We can go to the next scenario. The next scenario is a chemical like perfume or detergent or even bleach splashing into the eye. What should be done?
so what you should do is, as we said, with, uh, with regard to the insect and things like that, you should flush the eye. So if it is chemical, you also make sure that you clean your hands and then get clean water or normal saline or lactated ringers and clean the eye thoroughly for at least uh, uh, 30 minutes. So you should
Okay,
be the first thing you should do any type of chemical that enters the eye, whether it's
you flush.
cleaning agents, gardening
Perfume,
chemicals,
detergent,
perfume,
soup,
detergents.
stew
Yes. So
for
why
the
you should
ladies
soup,
when they're
stew,
cooking in the kitchen. Yes,
exactly. So what you should do is clean the eye, keep cleaning the eye thoroughly for at least 30 minutes. After
I
then,
like that
you
you
try
said
and
30
empty it
minutes
with the
because
yes.
sometimes people just tend to try cleaning the eye with water for 5 minutes, 10 minutes, and when they don't feel instant relief, they just give up and maybe try other mints, which don't necessarily bring about getting the agent, the chemical out of the eye. So it's good that you said 30 minutes.
Yes,
30 minutes is a good time to work with.
yes, exactly. Because we wanted to, chemicals used to change the pH of the eye, the level of acid or base inside the eye. So
Okay.
putting that water for a long period of time, we are trying to neutralize, to
The
balance
pH.
the chemical composition of the eye, the pH of the eye.
Yes.
So 30 minutes is like a reasonable amount of time
To work
that we
with. Yes.
expect the eye to just turn to the normal pH. And if you, whether you have got relieved or not, you should try and go to the eye care professional so that they can assess the level of damage, if any, and then put you on the next line of action. But the first thing you should do is that cleaning of the eye with water
Before
for that
rushing
period
to
of
the
time.
emergency room.
Yes, before rushing it. Because waiting for you to get to the eye clinic
Yes, is
is,
another risk.
not to cause severe damage inside the eye. So you should
Okay.
try, if you do, maybe if you are, you can be doing it while on your way to the eye clinic.
Eye
You'll be
clinic.
cleaning the eye. Maybe if you are inside a car, keep
Yes.
cleaning the eye until you reach to the hospital.
Okay. So that's amazing. So how can someone know if they might have a retinal detachment? No, but before then,
Okay,
let's take
so
sharp objects. Like in kids, they usually play with pencils in school or even at home or on the playground. What should be done when sharp objects like a pencil enters anyone's eyes, an adult or a child likewise?
so getting a sharp object into the eye is a very serious eye emergency. So, like pencil, people that work, like carpenters have sharp object entering someone's eye. You shouldn't touch the eye. You shouldn't attempt to remove that sharp object. Yes, because if you try to remove the object, the contents of the eye might follow to you. the hole that was created by that object. So what you should do is do not touch the eye. Yes.
Important.
You
Can
don't
you
have to
say
do
it again,
anything. What
please?
you should do, you shouldn't touch such type of sharp objects. Never try to remove them.
Okay.
What you should do is maybe get a paper cup, put it around the eye in such a way that it will not touch the sharp object, maybe
So
cover the eye
shielding
with
the sharp object is the first
yes,
thing to do
shielding the sharp without applying pressure on the eye.
on the
Don't
eye.
go and put something that will also apply pressure on the eye.
Okay.
That's why I gave an example of
Of a
maybe a
cup,
paper cup
paper
or
cup, yes.
this, or something that has a
Okay.
yes. And then after you do that, you go to the hospital immediately.
Yes. Okay, so now let's talk about people with retinal detachment. How can someone know if they might have a retinal detachment?
So a retinal detachment, how the patient will notice that is the person might be seeing flashes of light, and sometimes you might be seeing something like a curtain, covering your
Vision.
vision,
Yeah.
or you might see some small droplets of things like water falling down, small black dots. We call it a swamp of bees falling down through your field of vision. So
Okay.
these are the signs of retinal detachment, and it could lead to permanent loss of vision if care has not been taken as early as possible. So once you notice these symptoms I mentioned, what you should do is try as much as you can to get to the hospital, because early intervention is the best in case of retinal detachment. When you go as early as possible, so the eye care professional might be able to save that eye from going
Blind.
blind.
To make this part really clear for our listeners, when you said flashes of light, are you talking of when there's light in the room and they're seeing flashes of light or streaks of light, or you're talking about a normal environment where there aren't necessarily any lights on, but you're like the only person in the room seeing flashes of light, something like lightning, right? Make it really clear to our listeners so
Yeah,
that they
yeah.
know it's a special kind of flashes of light.
So when I say flashes of light, it doesn't mean like looking at your bulb and to be going up and on. So the flashes of light you will notice is whether you are in a bright environment, whether
Or
you are in
not.
a dark,
Yes.
anywhere you are, you'll be just seeing like flashes of light inside the eye. People
But
around
you're the
you
only one
wouldn't see
seeing.
anything. It's only
Yes.
one. Yes, you're the only one that sees that. It's
Okay.
because the retina has detached from where it was before. That's
Okay.
why you are seeing that flashes of light, and you are the only one that will see the flashes.
Okay. So our next scenario is, what are signs of a central retinal artery or central retinal vein occlusion?
Okay, so central retinal artery occlusion or central retinal vein occlusion normally is when the artery that supplies the eye with blood, or the veins that drain blood out of the eye occluded for one reason or the other. Because blockage of the artery could block blood from reaching
The
the
eye.
eye. So once there is no blood, there will be no nutrition to the structures of the eye, especially the central retinal artery occlusion. We call it an eye stroke or ocular stroke, like the way we have a stroke in our body, So that's how the eye is. The eye is not getting enough nutrition, and then the structures of the eye will start dying. So patient usually, the symptoms that they used to see, transient loss of vision, you just see that you're no longer seeing things
All of a
for
sudden.
maybe a few seconds, yes, for a few seconds or a few minutes, all of a
And then
sudden.
it comes back.
So
So
that's,
transient.
yes,
Yeah.
transient, yes. So that's the sign that you know you are having something like the artery or the vein has occluded. And what you should do in such a situation really is there is an ocular massage. Massaging the eyeball. Close your eyelids and do massaging the eyeball. So luckily enough, when you do that, the blood may start flowing to the structures of the eye and everything will come back to normal at that time. But that shouldn't
Stop.
uh, stop you from going to the hospital
Exactly, to
because
the emergency room.
retinal open artery occlusion is an even indication that you get a stroke, a systemic stroke,
Stroke.
stroke of the general body. So it's an early sign. It starts usually from, sometimes it started from the eye. So when you have the stroke of the eye, you are very likely to maybe have
A systemic stroke. And this
general
is why
stroke within
we
few days.
always emphasize on the importance of seeking eye care. Because when you see your optometrist, you can actually get heads up on any systemic disease that's ongoing. With just an ophthalmoscope, which is a very powerful tool that we use to look at the structures, internal structures of the eye, we can know if you're having hypertension that's undiagnosed, or diabetes, or sickle cell anemia. And now this is something very interesting that you brought up. An eye stroke can mean
Yes, so
systemic stroke is on the way, right?
yes, exactly. Because we used to say that eye is the window to our body, so
True,
everything
very
that
true.
is happening inside your eye can
Can be
be,
seen.
related to your eyes. Yes,
Yes,
and it can be seen by the eye care professionals, and person may be properly guided, and it might save your life.
yes. So basically, optometrists don't just save eyes, we save lives indirectly or directly too.
Exactly. That's correct. That's correct.
So let's go to the next question. What advice would you give to help people avoid ocular emergencies in the first place?
Generally, to avoid eye emergencies, what you should do is like, you know, make sure that you take care of your eyes very well. Using so whenever you are doing a task that might prone you to one form of eye emergency, you should be wearing a protective eyewear. And also, the most important, is try and get your eye doctor regularly. There might be some eye emergencies that doesn't show you any sign or symptoms. Your eye will be damaged within a very few times. So you should be seeing your eye doctor regularly, and whenever you feel something is wrong with your eye, as you mentioned in the red eye, so you shouldn't overlook that. Get
Okay.
your eye doctor, protect your eyes, protect your children when they are playing, and also, uh, avoid sharp objects in the home like the chairs, you know,
And don't let
other home
children
appliances.
play with sharp pencils unsupervised or other sharp objects, as you said. Yes.
Yeah. So these are the things you should do to avoid eye emergencies.
Okay. So, we all know people that love to reach for home remedies during an eye emergency or any other emergency. But some of these actually do more harm than good. What are some of the most dangerous home treatments you've seen for eye issues, and why should they be avoided?
Okay, so normally in our community, especially in the developing countries, the rural areas, people used to do so many funny things with regard to their eyes. Once they see the eyes not looking good, some they might be applying, breast milk. Some might be applying a urine inside the eye. Some will go to the chemist, buy some, capsule or some form of injections and be putting a drop of that injection into the eye, which is
Directly, which is really
yes,
dangerous.
directly, really, really
So they
dangerous.
go
And
to a
it's
nearby drugstore. Is that what you're saying? And buy capsules, antibiotic or
buy
random
capsule.
capsules?
Yes, that's what people used to do, which is very dangerous. Or,
Very.
some people applying breast milk, urine, which will do more harm to the eye. And some people, you see them, putting some form of herbs inside the eye, which is not good and it's not ideal. So many practices people have been doing them with regard to their eyes, which are causing more harm to them than good.
And another thing I would like to add to what you just said is with the advent of social media, it's really easy to get information that is unverified around. So without any backup or research, a random person that just has access to the internet and a smartphone will just sit in front of the camera and record random herbal concoctions that they will claim cure eye diseases or cataract, glaucoma, or minor infections. Sometimes you'll hear them saying, no, cucumber slices or aloe vera can get rid of glaucoma. No, eating onions can cure you of cataract forever. That is why we really need more eye health education, because sometimes
Exactly.
even people that are educated tend to believe such, and because eye care is a little inaccessible and unaffordable in this part of the world, people tend to
Yes.
really go for those home remedies.
Yes, exactly. But there are a lot of people doing that. You see one idol or uh, one traditional medicine that will cure maybe 100 type of disease.
Yes,
Common sense
yes,
will tell you
yes.
that's not true. So we always advise people, not
To
joke,
seek
especially your eyes. Do not seek medical advice
care.
from professionals.
Yes.
And we have some regulatory agencies that are working tirelessly that is regulating such type of practices.
Okay.
So to our audience, I will advise you that you should do not seek medical advice or medical care from anyone that is not professionally certified. So if you do that, so you're on your own.
And you're saying hello to blindness. You're really asking
Yes,
for it,
exactly.
buying it with your own money. So, in emergency
Exactly. That's
situations, optometrists become the first responders most of the time. What quick life-saving actions should every eye doctor be trained to take immediately when there's an ocular emergency at hand?
Yeah, so the most important thing is, you know, for every optometrist, you have to be well versed in treating all such type of ocular emergency that you can encounter. Getting the knowledge is the best thing that you can do to help people with emergencies, because uh, there is no way that you know um, people will come to you without knowing this type of emergency, and uh, you say you try and treat this such type of emergency. So getting the well knowledge and also getting the right equipment and facility to to manage or treat ocular emergencies or give first aid is also very important for every optometrist. So that's
Yeah.
the part our
So,
doctors should
so
try
optometrists
and
should
do.
be ready to irrigate when there's chemical accident, or when there are cases of insects or foreign bodies that can be removed, they should get ready to remove them with the necessary
Exactly.
tools and equipment. And then
Exactly.
when there are really serious ocular emergencies that might need surgery, like in the case of retinal detachment, it usually can be fixed with laser treatment. But then in this part of the country, laser treatments are even very difficult to find in any regular facility. Only a few of them
Yeah, exactly.
in the big cities have them. So be ready to refer. Or when the object, as you said, sharp objects that get embedded deeply into the eye. So as an optometrist, you should be ready to identify that and refer immediately. They say the best
Yes,
doctors are the
exactly.
doctors who refer. when it's out of their scope.
Yeah, that's true. Some of the eye care professionals might say, uh, might not be able to identify what you are presenting as an emergency. So, there is no way that eye can be saved because it was
Yes,
not even identified. So, identifying the ocular things as an emergency is very important.
very
And also
important.
making appropriate referral. If you are not
Mm.
able to treat or you don't have the facility to treat such type of emergency, that's why going to eye care professional is very important. Some emergencies will be handled by technologists, the eye surgeons, and some
Since
of
it's
the
a
emergencies
teamwork,
are
yeah.
handled by the authorities. Yes, so that's how the
And in
things
some rural settings where
stay.
optometrists aren't readily available, ophthalmic nurses handle such minute emergencies, if I can call them minute, because every emergency is actually really
Yes, that's true.
important. So, so it's actually a teamwork.
Yes,
Some
exactly. And
emergencies can be treated by nurses, ophthalmic nurses, some by optometrists, and some by ophthalmologists.
yes, exactly. Even by the patient himself,
Exactly.
the first step is there are things that you can do something on your own,
Yourself.
even before
Yes.
coming to the yes, like that eye irrigation, cleaning
Mm.
out of the eye, is
Yes.
something that you start doing it even before coming to the hospital. So when you come to the hospital, whether you get the family nurses, the ophthalmologist, anyone that you see, if you have the knowledge about that emergency, you'll be able to do something before making the appropriate referral.
Okay. So I want you to tell us if you've ever had an eye emergency case in a rural clinic where you had to improvise. What was the challenge and what did you do?
When I have seen a lot of this uh, emergencies in the world, the one that I will never forget is there was a time that a mother brought her child. She is not up to 5 years. The child it was during Hamatan, and that child was sitting by the fire. In rural areas, people used to sit around the fire to warm their body. So, and while sitting at the fire, there was a battery, alkaline battery, not ordinary battery, inside that fire, and they didn't know.
Oh,
And in a very few minutes, that battery just exploded. Boom.
oh my
And
God.
the thing is, uh, was, enters the eye, the small bones around the eyelid. So they brought him to me. And when I look at that child, I said, oh, when you encounter emergency, sometimes your brain might be, you just like shut down, not knowing what to do.
What to
But
do first?
by
Yes.
immediately, I know I have to do something. Yes, even I have, I start cleaning that eye, start irrigating the eye. I get a normal saline, you know, I start washing the eye, you know. After doing that, for like it is even up to 30 minutes, as I mentioned earlier. I spent like almost an hour cleaning the eye because
With
the thing
water.
was so
So
choked
you
up inside the
irrigated
eye.
and kept
Yes,
irrigating and
and
kept irrigating.
yes, for almost an hour. And the thing is still, it's reducing, but it's not cleared completely. And before I started doing that, I told the mother to arrange to transfer to the hospital because around that area there is no any hospital that will get eye services. So I told them to arrange for the transport. Once we are done with the irrigation, at least the patient we might be
Should
able
go
to
to the eye
reduce the
clinic.
symptoms. Yes, we should go to the eye clinic to assess the damage and further management with bigger facilities, with the right facilities. So I do that irrigation, and fortunately the eye was
Saved.
getting much much better. Yes, use cotton wool to clean some of the areas, to irrigate the eye. Before you know, everything was 90% of that thing has been removed out of that eye,
And
and
then
the
you
child
advised
was
for
getting well.
further
Yes,
emergency treatment of follow up
yes,
rather.
exactly.
Yes,
A follow up.
in
Yes,
the
after
clinic.
doing that, I told the mother so how when she saw the child, she was so happy. that the eye has been saved, because when you look at the child first, you might think that eye has been gone.
Gone forever.
So
Yeah. I
yes,
can imagine how she felt. And you know
exactly.
what's really beautiful about the part where you told them to seek for the eye care to follow up in an eye clinic? It's that
Mm,
many patients think because you're an eye doctor, you can actually treat everything at home, which is wrong. There's
yes, exactly.
wisdom in
That's
going to the clinic because you have equipment there. For example, the slit lamp biomicroscope that we have in the clinic, it can magnify and show you deeper layers of the eye, and you can see the extent of damage. So that is why it's important to go to the clinic.
yes, that's correct. So let me finish telling you the story. So
Okay, okay.
after irrigating the eye, I turned to the mother, telling her, so the eye has gotten much better, but they still need to go to the hospital. So, and that woman, she just turned her head down, and she started crying because she don't have the money to go to the hospital. She don't have the money to pay me for the service that I've done.
That you
She
have.
don't have the money to
Mm,
even buy for the drugs. So she was just crying. Then she told me that actually she could not go anywhere. She don't have anything to go to any facility. Thank God I was able to do something on that child. That thing is enough for her. She don't have a chance to go anywhere. So
even if she
I,
wanted to, there were financial challenges, which is the
yes, she
norm,
wanted to.
which is the story of plenty households in Nigeria, especially in
Exactly,
northern
that's true.
Nigeria.
That's correct. So I had to get some eye drop and ointment, give to the child. I didn't even collected their money because that's
Because
the
they couldn't
only
even
thing we
pay
can do
you,
for them. Yes, they couldn't even
even
pay
if they
me, they couldn't
wanted
even,
to.
and me too at that time I don't have money for me to assist them maybe to go to the hospital, and
Hospital, but at
she
least
told
you
me
did
she
the
can't
best
do the
you
eye drop.
could in your
Yes,
capacity.
exactly. So I told the mother that still she should go home and maybe ask her colleagues, her siblings, the father of the child, if they could get something so that they go to the hospital. And I give them that idea to go. So that's my last encounter with that woman. And I felt much,
Very touching.
that I didn't choose the wrong career actually.
Yes,
So
because
it's very rewarding.
things like this
Yes,
keep
at
you
least I know
happy
that I
for
have saved.
days.
Exactly. Because I know that I have saved that child's eye. And in fact, they didn't go to the hospital. They came back some later time. The eye was very okay. Everything was normal. The woman was thanking me, saying that I have saved her child's eye. Things like
You've
that.
become a superhero basically in that
Exactly.
rural area.
Yes.
Okay, so let's lighten things up a little. We're going to our fun would you rather segment. So I'm going to ask you two questions and you tell me which one you'd rather. So,
So I'm
would
actually challenged now.
would you rather train 100 market women on first aid for eye injuries or do a live emergency eye care demo on national TV?
Okay, so actually, I would rather do a a demo on national
National TV,
TV so that I can educate a lot, thousands of people,
wider
people
reach.
now,
That's a smart one.
yes, yes,
So,
exactly.
would you
And that
rather
will
lose?
reach to another set of people. So
Yeah,
before the whole community have gotten the knowledge I want to pass.
that's so true. That's a very
Yes.
smart choice. So, would you rather lose
So,
your ophthalmoscope for a week or run out of eye drops during clinic hours?
wow. I would rather I would choose the ophthalmoscope. Using the ophthalmoscope, that means you miss so many cases. Some cases that doesn't even need eye drop to cure them. And eye
True.
drop, even if they are not available in your clinic, people can get them
Out.
somewhere else. But your ophthalmoscope is a very powerful tool that you'll be able to diagnose diseases. You have to diagnose before you start treating with eye drop.
Treating. Very, very, very
Yes.
true. Okay, so the
Yes.
last one is, would you rather explain glaucoma to 50 teenagers or convince one grandma to stop self-medicating with herbal concoctions?
Actually, I will educate the teenagers about glaucoma than that old woman. All people are really tough to handle.
Convinced,
She
ba?
has been born with that news. She will be very hard to convince. She has been
Yes,
born with that habit, and since she reached that age,
exactly.
she
And
maybe
should
some
be
few
like,
years
since
afterwards,
before you were born, these things were curing
it has
vision and sight problems. So you, this
for her.
little
Yes, it has
child.
been doing the magic for her. So there is no way you tell her that now you should stop doing that thing. No, no way.
Dr. Labaran, this has been incredibly insightful. And before we go, what would you like to say to someone listening right now who's tempted to wait until tomorrow to deal with an eye injury or an eye emergency?
So actually, to the people out there, eye emergency is something very serious. You don't have to wait till tomorrow. As I mentioned, do not wait for even a second. Try and get to the eye care professionals or do one thing or the other that we have mentioned when you encounter an eye emergency. It's very, very serious. It can lead to permanent loss of vision. And blindness is not something that you want. So please, whether it's you, your family member, anyone you know that you have seen he has an eye problem, tell him to go to an eye clinic. Do not wait for even a minute. That's my message to people out there.
Okay,
Take care
thank you
of your
so much,
eyes.
Dr. Labaran. Thank you for sharing your expertise with us today. And thank you to everyone
You're
listening.
welcome.
If you found this episode helpful, please subscribe, share it with your friends and colleagues, and follow us on social media at Happy Eyes _ with Dr. Amal. Until next time, keep your vision sharp and your eyes happy. If you have any question or topic you'd like us to explore on the podcast, would love to hear from you. Please drop us a message at amaldambata@gmail.com or connect with us on Instagram at Happy Eyes _ with Dr. Amal. Let's keep the conversation going and growing. Thank you for tuning into Happy Eyes Pod. Don't forget to follow, leave a review, and share this episode with someone who loves their eyes. Until next time, keep your vision clear and your eyes happy.